This video will explore various supportive measures and techniques along with different positions to inform your future laboring and birthing experience.
Support can come from both individuals and equipment. There's a lot of research that emphasizes the importance and advantages of support people during labor. Continuous labor support has been shown to decrease the number of cesareans, increase spontaneous vaginal births, decrease the risk of being dissatisfied in the birthing experience, shortens labor by 41 minutes, and results in increased natural oxytocin release, increased mobility, increased self-esteem, decreased pain, and decreased anxiety. There are many different pieces of equipment that can be used to help support someone during the labor and birth process. Birthing balls or exercise balls come in many different sizes to accommodate different heights. Peanut balls are similar to birthing balls, however they are shaped like a peanut. Peanut balls also come in various sizes. A birthing stool is a stool that is low to the ground and open in the middle to allow room for the baby to descend. Rebozo originates from Mexico and is a piece of fabric that can be used to help support someone during labor and birth. Scarves, baby wraps, or bed sheets can also be used in place of a true rebozo. Knee pads or yoga mats can be used to relieve pressure on the individual's knees, increasing comfort. The bed can be manipulated into different positions to help increase movement and comfort. Birthing tubs and showers may also be used. Hydrotherapy creates a calm environment, helps with muscle relaxation and comfort, and acts as a natural pain reliever. When a person is in a tub, they are also able to move around freely, increasing movement throughout labor. Finally, hydrotherapy can help birthing individuals feel more in control and supports a positive birthing experience. Combs, fans, and massagers can also be used to increase comfort during labor and birth. Now we will discuss various laboring and birthing positions.
Early records of birth show individuals utilizing upright positions, usually squatting or kneeling. Recorded history shows that upright birthing positions were used extensively, and it was not until the last 200 years that Western cultures adopted horizontal positions. Recent global statistics indicate 68% of birthing individuals deliver in the supine position, and 23% deliver in a semi-sitting position. This leaves only 4% of the birthing population delivering in upright birthing positions, 3% delivering in a sideline position, and 2% delivering on their hands and knees. Many factors may contribute to this, including social and media norms, as well as healthcare provider convenience and comfortability.
Upright birth refers to laboring and birthing in any position other than lying on your back or supine. Upright birth includes hands and knees, squatting, standing, and leaning.
Upright birthing has many benefits, including the use of gravity to help the baby descend. Upright positions also allow a person to easily change positions and produce micro movements, which can help ease pain and discomfort the laboring individual, as well as aid the baby's descent through the birth canal in an engaged and more favorable position. Upright positions also allow for the rhombus of Michaelis, which is a part of the sacrum or lower back, to open up. This creates more room in the birth canal, helping the baby to descend and exit the birth canal while also relieving some of the pressure on the laboring person's sacrum. Position changes are also beneficial in helping a person whose labor has slowed down to find their rhythm again. Upright birthing has been linked with more effective contractions, decreases the risk of third and fourth degree tears, shortens the length of labor and pushing, reduces the risk of abnormal fetal heart rate patterns, and decreases the number of interventions, such as pain relief or epidural use, instrumental birth via vacuum and forceps, and cesarean sections.
Upright birthing is not without limitations. Upright birthing can lead to increased fatigue, especially during prolonged labor and pushing. Upright birthing also does increase a person's risk of first or second degree tear and can minimally increase the amount of bleeding a person experiences. Other birthing positions include the lithotomy position, where the birthing individual's legs are in stirrups, the supine position, where the individual is lying on their back, and the side lying position, These positions are beneficial when the individual is fatigued and may have had a long labor. Additionally, they are easier to use when epidurals are in place. The World Health Organization has a set of guidelines that includes recommendations for a positive childbirth experience. Number 1 is respectful maternity care, which refers to care organized for and provided to all birthing individuals in a manner that maintains their dignity, privacy, and confidentiality, ensures freedom from harm and mistreatment, and enables informed choice and continuous support during labor and childbirth. Number 25 is encourage the adoption of mobility and an upright position during labor in individuals at low risk. Number 34 and 35 are birthing individuals with and without epidural anesthesia, encouraging the adoption of a birth position of the individual's choice, including upright birthing positions.
Movement through labor can also be beneficial, whether this be alternating positions or facilitating micro-movements in each position. This helps the baby rotate through the bones of the pelvis, finding the best pathway for descent. Movement can also encourage the baby to adopt favorable positions. This is also associated with decreased pain and faster labors. Now we will move on to demonstrations of different laboring and birthing positions, including brief discussions about each position. Squatting positions allow for the majority of weight to be put on the feet. This position allows for gravity to assist with the labor and birth. A drawback of this position is that it may be difficult to hold a squat for a long period of time. Using supportive tools can reduce this pressure and fatigue, allowing the squat to be held for longer. Research has found that squatting with support decreases the length of the second stage of labor, decreases pain, and improves perceived pushing efficacy. Birthing bars or squatting bars can also facilitate this position. These are typically available on hospital birthing beds. In this image, we are using a rebozo to mimic a birthing bar, which can be used as an alternative if the bar is not present.
The kneeling position is useful when the birthing individual is experiencing back labor. Kneeling encourages movement of the baby, helping labor progress. There is also no external pressure on the pelvis, which allows the birthing individual to move more freely. There are various tools that can be used to support this position, including knee pads, a cub, and the bed.
Sitting on a supportive object also allows for gravity to aid with the baby's descent. These supportive objects can include a birthing stool, birthing ball, and a cub, among many other things. They are typically low to the ground, which also allows for the legs to flex and increases the size of the pelvis. This image is demonstrating a hip squeeze, which is used to relieve pelvic discomfort and back pain. It is also a method of counterpressure as it relieves pressure, especially during contractions. This image is showing how a support person or nurse can apply counterpressure to the sacrum or lower back. It is especially useful during contractions and when the baby's head is pushing against the sacrum.
Lunging can help to relieve discomfort during contractions and helps the baby to descend through the pelvis.
Lateral or side-lying positions allow for the pelvic outlet to open and are favorable when the individual is fatigued or has an epidural. A peanut ball can be placed in between an individual's legs in the side-lying position to help open up the pelvis.
When someone is in the lithotomy position or on their back, a towel or a sheet can be rolled up and put at the bottom of their back to help open up the pelvic outlet by increasing the space between their back and the bed.
Here are a few videos demonstrating how movement can be used in different positions throughout labor and birthing to increase labor comfort and help the baby descend. There will also be some demonstrations on how a support person can help the individual with movement.
You can inquire about the resources available at the institution you may be laboring and birthing at. This will inform you about what you may want to bring with you versus what is already provided at the hospital. Currently, as of 2025, Kingston General Hospital supplies birthing balls, birthing stools, squatting bars, shower chairs, and birth tubs. Priority for birth tubs is given to patients with midwives.
There are many cultural factors that can affect an individual's goals and wishes for labor and birth that need to be considered. This can include, but is not limited to, the location of labor and birth, such as at home, hospital, or a birthing center, the equipment used during labor and birth, the number of family members and individuals involved, and rituals or practices involved with labor and birth.
Remember, the choice of position during labor and birth should be up to the birthing individual. Various factors can influence which positions are feasible, including cultural preferences, pre-existing conditions, prolonged labor, fatigue, pain, epidural use, and the well-being of both the infant and the birthing individual. While upright birthing offers many benefits, it is not always practical for everyone. The key is ensuring that the birthing individual feels informed, respected, and well supported in their chosen labor and birth position. We would like to take this time to thank some key members in creating this presentation. Thank you to doula Lauren Miller, who acted as our birthing model, doulas Chelsea Lutsenko and Mandy McClellan for supporting our learning and helping to create this project. Thank you to Alicia Papanicolaou for taking the time to provide knowledge and guidance to help enhance our project. Thank you to Dr. Rebecca Rooney, an obstetrician gynecologist, and labor and delivery nurses Cecilia Evers, Erica Wall, and Talia Ross for the knowledge and expertise they provided. Thank you to our course coordinator and seminar leader, Sherry Schmidt-Stutzman, who has supported us and helped with the direction of our project throughout the semester. Finally, thank you to Dr. Danielle McDonald for providing resources and information to better understand this topic.
Thank you for listening. This video was created by Grace Cokes, Gabrielle Evers, and Sarah Groves in partial fulfillment of the requirements for Queen's University Nursing, Practicum in Community Health Promotion.